Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our 9th webinar in our new series on workplace mental health and well-being best practices. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. The pandemic has certainly upended the lives of most Americans, and most businesses in this country have drastically been impacted. These webinars that have been conducted now for the past 7 months have focused on going on offense to address the impact the pandemic is having on the emotional well-being and mental health of individuals. The topic of today's webinar is on best practices of integrating mental health and well-being. There are many research studies that show the serious need to eliminate the silos that often exist between medical care and behavioral health. The Milliman American Psychiatric Association report is one of those. You can download that report during the webinar through your control box. The most effective healthcare system in the world, the South Central Foundation's NUCA system of care in Alaska, has done that successfully. They are the only healthcare system that has won the Malcolm Baldrige National Quality Award twice, once in 2011 and again in 2017. Countries from all over the world go to learn how the NUCA system of care has achieved astonishing results in improving health of its enrollees while cutting costs of treating them. The Stanford Social Innovation Review summed it up well when they said, in an era of soaring healthcare costs and demands for reform, the South Central Foundation represents the possibilities of a system that emphasizes wellness over treatment of disease and community relationships over profit. Now, we can't all purchase healthcare from the NUCA system of care. Their focus is the Native Alaskans throughout Alaska. However, we can learn some important principles from that system to make sure that the strategies that we employ are incorporated in our systems. Perhaps none is more important than integrating mental health and well-being. As Dr. Douglas Eby, Vice President of Medical Services for the South Central Foundation, describes it so well, patients are the benefactors of our institutions of medicine in the United States. So our traditional healthcare is about people coming to the system to be benefactors of the institutions of medicine. The focus is on patients benefiting from the great wisdom and innovation of the healthcare system. The South Central Foundation has turned that system on its head. Instead of the healthcare system being the focus, the customer owner patient is the focus, and healthcare is focused on improving health, well-being, and the happiness of individuals. The NUCA system of care is built around the understanding that personal, long-term, accountable relationships with customer owners, the patient, their families, their communities are the key to making a difference in ongoing choices and habits that drive health and well-being. The NUCA system assigns each member of the population a team of providers who come to know and trust that member, and that the member comes to know and trust. NUCA's vision statement is that every interaction with a customer owner or patient will elicit some level of change. NUCA accomplishes this by training every member of the treatment team, physician, nurse, pharmacist, on things like motivational interviewing, empathetic listening, and the importance of building trusting relationships with each member over a long period of time. Wouldn't it be nice if every doctor, nurse, and pharmacist in the US were trained to have some of that same focus? Well, that's not going to happen overnight. But what every employer's healthcare strategy can employ is effective behavioral-focused health coaching. A health coach who is not expensive can be assigned to each member of the population and build that trusting relationship and be the catalyst to ensure that there is an integration between mental health and well-being. As of January 1st, 2020, the American Medical Association has approved CPT billing codes for health coaching, which can now be built into an employer's health plan strategy. And the cost can flow through the plan as a preventive claim, as would well-being visits to the doctor, or a vaccination, or a mammogram, or a colonoscopy. Here's the American Medical Association's definition of health coaching. Health and well-being coaching is a patient-centered approach wherein patients determine their goals, use self-discovery or active learning processes together with content, education to work toward their goals, and self-monitor behaviors to increase accountability, all within the context of an interpersonal relationship with a coach. The coach is a non-physician healthcare professional. Training includes behavioral change theory, motivational strategies, communication techniques, health education, and promotion theories, which are used to assist patients to develop intrinsic motivation and obtain skills to create sustainable change for improved health and well-being. I'm honored to have as my guest panelist today, Jenny Gray, who is not only a health coach herself, but also the coach trainer for Orient, one of the most experienced health coaching programs in the country with over 20 years experience in health coaching. Jenny, thank you for being with us. And would you like to take a couple minutes to introduce yourself?
Hi, thanks for having me today, Daryl. Yeah, so I'm Jenny Gray. I'm the coach training manager and the continual quality improvement manager here at Orient. My background's in exercise physiology and wellness, along with nutrition. I've been with Orient for 8 years and been a health coach, been a supervising coach, and been the training manager, just making sure that our coaches are the top of the line, best in the industry.
Nice. So let's start by asking, when you choose or select or hire a coach, what are kind of the personalities, what type of person are you looking for to train?
Well, health coaching is really about relationship building. And so I think it's important to first note that all of our health coaches have a minimum of a 4-year degree in a health science, which is different from just a 6-week health coaching certificate. So all of our coaches that we interview for and all the coaches that we hire are extremely qualified from an educational background standpoint. But what we're looking for when we're hiring is really someone who can build relationships, someone who can express empathy, someone who actively listens when they're communicating with you, really someone who can establish a trusting relationship with somebody, because that's going to be the most important component to our health coaches in establishing relationships with our participants.
And that's really hard to train, isn't it? It's almost like you have to find someone who innately has that characteristic, because it's just a very difficult thing to train someone in.
Yes, it's all, I like to tell new coaches who are sometimes a little bit overwhelmed that we hired you because you can do this, and I can teach you anything else that you need to know.
Very good. So describe to us, what are some of the principles involved in coach training?
So we do a lot of different coach training series. The most important and most foundational is with motivational interviewing, which is a style of interviewing, as you might expect, a style of communication where the coach uses open-ended questions, uses reflection, uses affirmations in order to encourage participants to really find their own solutions to problems and barriers and struggles that they're experiencing. It requires coaches to be empathetic. They're really trained to be partners. They're really trained to focus on participant autonomy. They really want participants to make the best decisions for themselves, and coaches are just facilitating and guiding that.
Nice. What are some of the continuous quality improvement processes that you use to ensure that coaches maintain a high level of engagement and effectiveness with their participants?
So we have several monitors. I personally listen and evaluate different participant calls. They still all remain HIPAA compliant. Nothing is shared beyond the coach and the participant. But we have certain metrics that I listen for and evaluate and provide feedback for with the coach. We have a standard of quality that we expect each call to meet. And I'm continually meeting with coaches on a monthly basis to discuss their scores, discuss their evaluations and feedback, see what their strengths they feel like are as coaching and how they want to build on those strengths and become even better coaches.
So what are some of those things you look for in a phone call?
Great question. So we listen for, first of all, an action plan, a follow-up. So every coach is going to create a plan of action with their participant. It's basically saying, what are you going to do after this phone call is over? And so coaches need to provide accountability for that. They created a plan together. They should provide accountability for that, whether they did it or not, but how they can follow up with that and be that accountability partner. We evaluate for empathetic listening. Were they dominating the call, or did the participant have the strongest voice? Were they distracted, or were they really engaged in what the participant was saying? We evaluate for engagement.
Let me stop you there, because that's, in my opinion, that's probably one of the most important things to measure for. Because if you listen to two people talking, and you can just be a third-party listener, you can tell whether they're listening to each other. It's like,
yes,
they're clearly not communicating well, and nothing really breaks down that trusting relationship more than the fact that you don't feel like you're being heard. So that's probably one of the most important things to listen for is just that, are they actually hearing each other? Is there good communication going on back and forth between the two?
Absolutely. And that usually happens just when a coach is just so excited to share what they know. We're so passionate about what we do. We have so much knowledge inside our heads, and we're just like, oh, I just feel like I can share all of this with you and it'll help you. But really, that's outside the spirit of motivational interviewing. When you're an empathetic listener, you're listening to the participant and what their big picture is, what their vision is, what would work for their life. And you're reflecting it back to them, because we really believe that participants do have their own solutions for their own problems, and that by engaging in that spirit of motivational interviewing, by being an empathetic listener, we can help guide them towards those solutions.
Which is such a huge difference from the traditional medical system. Medical care is often, let me diagnose you, let me identify your symptoms, and then let me give you a treatment plan.
Absolutely.
That just doesn't work with behavior. People don't change often just because someone else told them to. They have to make that change inside, and that's a difficult thing to do. That's one of the most difficult things there is to do in healthcare.
Exactly, and it's a frustrating part of healthcare. Talking with many doctors and many therapists who get frustrated because they see the same patients over and over again, and they have the same conversation over and over again, and they write the same prescription over and over again, and there's a lack of follow through. And that's one of the really great parts about working with a coach, is that there's such a disconnect between intention and action. We intend to do things, we know the things that are good for us. Nobody's surprised when a health coach says, are eating fruits and vegetables, drinking water, exercising daily, sleep and stress management are going to make you feel better.
Right.
Nobody's surprised by that information. So really working with a health coach provides the value of connecting your intention with your action and identifying where that ambiguity is lying and helping the participant overcome that.
So I know I've used the term that we have two brains. We have a conscious brain and we have the amygdala, that unconscious brain that loves to keep us in the ruts we're in. And talk a little bit about how the coach is really an accountability partner to help the conscious brain, who aspires to get out of those ruts, to overcome that amygdala that just doesn't like to change.
So a big part of what we do is what we call highlighting change talk. So you might hear something from a participant that says, well, I want to exercise in the morning, but my room is so cold and it's so early and I just want to hit the snooze, and I just end up hitting the snooze button and going back to bed. So they voiced a desire for a change. I want to exercise. And then they followed it up with the reasons that they don't, which is very common. Most of us do that, is that there's some level of just ambiguity there. Right. That's kind of, we're straddling that proverbial fence of change. And so the job of the coach is really to highlight the change talk. So they might say, it sounds like there's some really significant struggles with getting up in the morning, and at the same time, you really feel like getting out of bed and exercising is going to make you feel more productive at work, or whatever is motivating that particular participant. So by being able to highlight their reasons for change, that the coach did not give them. They are reflecting exactly what the participant just said to them back to them. They get to hear their own reasoning for change, and they get to be able to be walked through that process, when in reality it's not a doctor telling them they need to change. It's not a coach making an argument of, well, you really do need to exercise because your blood glucose levels are not good and this is going to help.
Right.
It's none of that. It's, you told me that you want to exercise for these reasons. I'm going to reiterate your own argument that you just shared for me. And so it's really the participant making their own argument for change, which is research shows is significantly more effective.
Nice. So can coaches get burned out? And tell me just a little bit about how, how a coach works with someone. Is it hours and hours that they might be on the phone with the person, or is it more shorter? And like, how many hours in a week can a coach work without getting burned out?
It's a really great question. And absolutely, coaches can get burned out. I feel like any profession where you have to consistently be expressing such a high level of empathy can be a real emotional drain, and we address that in a few ways. One, there's a reason that I meet with coaches every single month, so I can have that relationship with them. They feel very safe coming and talking to me if they're starting to feel those feelings of burnout. I like to catch it at the beginning rather than when they're already very deep into it and exhausted. And we have flexibility of changing hours worked, adding more variety into it, I have health promotion projects that you can work on. You can help with customer support. There's different varieties of things that you can do to just kind of shake things up and take off that emotional burden. We also have a full-time coach is a 32-hour-a-week coach. It is not a 40-hour-a-week coach. And that really does help reduce the emotional burden. It gives coaches a chance to breathe, and make sure that their own emotional needs are being met, because you can't draw water from an empty well. If our coaches are depleted, then it's very difficult for them to be that reservoir and be that empathetic source for their participants. So that is something that we're very mindful of.
That makes a lot of sense. How do you measure coach effectiveness?
So going back to just with that continual quality improvement, we are doing evaluations with coaches. There's metrics that they do need to meet. There are also customer satisfaction reports that are sent out after every single coaching exchange. So if you talk with a coach, you are going to receive a very short survey asking about your experience. We take that feedback very seriously. We share it with the coach, both positive and negative. So if you love your coach, we love to share that with them as well, even more so. But yeah, so that's an every interaction occurrence. And we can also tell by the changes that participants make. We do annual assessments where we can see and evaluate their biometrics, and year after year we see improvements and that exist when you work with a coach, and declines in participants that don't work with coaches. And so there's tangible biometric evidence and numeric evidence that supports the effectiveness of working with a coach, and you can see that.
Let's now talk a little bit about the integration between mental health and well-being. What role does a coach play in identifying, addressing, and being a catalyst for those that are struggling with emotional problems at getting the help they need? We all know there's a huge barrier to mental health. Stigma is a very difficult thing to get around, and a lot of people, the numbers show that about the people with mental health symptoms wait 10 years on average before they reach out for help, and almost 60% never reach out for help. So talk a little bit about the critical role that a coach can play based on the relationship they build with people at helping their participants get the help from the mental health professionals and kind of be that catalyst and helping them get through that barrier.
Absolutely. And you hit the nail on the head. It really does come down to the rapport that you have with a participant. It's something that it's a level of trust that needs to be earned, and that's not taken lightly. You can't expect someone to open up and reveal all of their struggles and their inner turmoil. It might start on a very surfacey, shallow level, but by being that empathetic listener, by sending the message that I am here for you, I don't have an agenda for you, I'm here to be a partner with you, that really does slowly, bit by bit, earn the level of trust and rapport from the participant, to which they are sharing a lot more about their mental and emotional states. And a lot of that coaches are very well trained to handle and work with the participant on. They're also trained for recognizing what is beyond their scope of practice, and for connecting them with services, with EAPs, with different resources available with their insurance that can connect them with a specialist or someone that they would be a little bit more qualified to handle anything that's a little bit more serious or beyond the scope of practice within a health coach. That doesn't remove the health coach from being part of that team. They're still a very contributive member of that team, but it just adds that extra component of health and wellness that the participant needs to be their best self.
Have you personally experienced that stigma as you've worked with some of your participants, where you can see that they could benefit from a mental health professional, but the stigma is a difficult thing to get over?
Yeah, absolutely. And it's something generational. I feel like there's a big difference. I feel like particularly for millennials, they're all in therapy already. but especially for Gen Xers and baby boomers, there's a significant stigma that they feel like seeking help is an admission that something is wrong with them. It's something that they should be able to power through, and something they should be able to just get over. And really having that empathy of, first of all, they're able to share those feelings with you is a huge sign. And also using motivational interviewing is a strategy that gets the participant to, again, make their own argument for change, for making their own argument of why a specialist might be beneficial for them. And of course, coaches respect their autonomy to choose of whether they go to a health professional or not. But we are there to describe the benefits that could come from working with a specialist, describe the reasons why we felt like a specialist might be beneficial for them, particularly to connect them with those resources and that information. And at the end of the day, just remind them that we respect their choices, and that we'll be that partner and that support for them regardless of what they choose.
Well, and I think you nailed it on the head that the coach can still remain a part of the team. And when you look at well-being, there's so many aspects of well-being. There's physical, there's nutritional, there's financial, there's occupational, there's intellectual, there's environmental. There's so many different aspects. And it could be that, some mental health issues are significant and are really getting in the way of the person making the progress that they want. But it could be other things. And I think maybe talk just a little bit about how coaches approach different areas of well-being with their different participants. And do they need to be experts in every area of well-being, or does it really just boil down to that whole reflective listening, and again, motivational interviewing and empathetic listening?
Great question. So one of the great things about our Resilience Pro Wellness Tracker is that participants are self-reporting when it's available, of self-reporting their own levels of wellness within each of those different aspects. So, and that's something that the coaches can monitor and really keep an eye on and reach out proactively if they see a drastic shift in any of those. So that's a great resource. But really it comes down to identifying the vision with the participant. What does their best self look like? And if they can describe that in the most concrete, descriptive of terms, that really gives insight to the coach of where their priorities are, what their core values are, and the coach can meet them where they are at. And different things might pop up, different connections might come along as they're throughout their relationship that lead them to know that. And to answer your other question of no, coaches don't need to be CPAs, and they don't need to be yoga instructors, and they don't need to, be HR representatives. They don't need to be, a master in all of those things. Because again, we really do believe that participants, more often than not, have the solution to their own struggles and their own problems. And by using motivational interviewing, we really make those connections and walk through that process with them. We're also great at recognizing what's within our scope of practice and what's beyond our scope of practice. And when they need help that's beyond our scope of practice, that's when we connect them with other resources for specialists that can provide more help than we can.
Well, and maybe as just kind of one of the final thoughts, in today's pandemic, the need for mental health professionals has exploded, and the supply is running out. It's difficult to get in to see a mental health professional, which is where health coaches can come in and play a very important role at supporting people who may just need the support of a health coach and don't need to tax the healthcare system in terms of psychologists and social workers and therapists. Let's allow those who really need that level of help to access those professionals, and let a coach support a lot of people that can be supported by a coach, especially right now when with the pandemic, there's a limited supply and a lot of people are struggling just to even get in and make an appointment to see a mental health professional.
Yeah, absolutely. And that's something that our coaches are more than capable of doing. We meet people where they're at. They have strong backgrounds in stress management techniques, and that motivational interviewing and supporting self-efficacy. And we're happy to be that resource that a lot of people really need right now, and a lot of people are really struggling.
Wonderful. So Jenny, before I wrap things up, do you have anything that we haven't covered that you'd like to share, and just kind of a closing few comments?
Sure. I think one of the great things about our coaches in particular is that we're really strength-based coaches, which I feel like sets us apart in the industry. It's not so much as identifying deficiencies and quote unquote, what's wrong with you, what's not working for you. We really work to identify and be like, okay, what is going well? You mentioned that you want to eat healthier. What do you already like about the way that you eat? What are the healthy components that you're already doing? And then we're going to build on that. And it's such a significant change from describing of I need to do this, I should do this, I should do this. I call them the shoulds. Everybody feels like they should be doing something different. And our coaches are really fantastic at identifying strengths and positive attributes about our participants, which increases motivation. It changes it reframes their mindset, and it reestablishes it into a growth mindset of I have all of these great things about me, and now I'm just building on them rather than emphasizing my deficiencies and all the things that I need to be doing.
Awesome. Thank you so much. So I want to remind everyone that Resilience Pro is the sponsor of this series of webinars, and a brochure describing the solution is available for you to download through your control box. Our next webinar will be held on Wednesday, December 16th. That's next Wednesday. Join us as we discuss ensuring access to quality mental health care workers. Again, join us next Wednesday at 9 a.m. Mountain Standard Time, December 16th. Now, as a reminder, the recordings of all of these webinars can be found on goingonoffense.com. The webinar also contains, or the website also contains, a host of other ideas, suggestions, resources, and helps for organizations that want to provide emotional well-being support to their employees during these difficult times. We suggest you check them out. The kind of health care that the NUCA system of care has built is referred to as aspirational health care, as opposed to traditional healthcare, which is deficit-based. So instead of deficit solving a problem, aspirational is preventing a problem. Instead of treating a disease, avoid a disease in the first place. Instead of prescribing treatment, inspire a change. Instead of healing someone, celebrate success. I'm pleased to announce that Orion is going to be sponsoring and putting on an aspirational healthcare conference this summer, July 14th and 15th, where we will be highlighting the NUCA system of care and other similar systems that have gone beyond our traditional deficit-based healthcare system If you're interested in learning more, reach out to us by using the Contact Us form on the goingonoffense.com website. Thank you again, Jenny, for being with us, and thank you for all the attendees for joining us today as well.
Thank you, Daryl.
Have a wonderful day.